So I'm here today to talk about the mental health crisis response service, which is part of the Vanguard, UC Vanguard. Paper in front of you, I guess that we did come across, because of obviously the challenges that we have, we knew that there was nothing for people in a mental health crisis, often out of bars, and people often had to go to A&E because there was nowhere else for them to go. So I think some statements there might actually happen. So we worked with service users and carers and many different agencies and actually came up with a model looking at mental health crisis care and one that was more appropriate for people with mental health problems to be able to actually get the right support in the right place. So we have developed a 24/7 mental health crisis service, and this service will be going operational on the 19th next week. Fully operational next week. There's currently limited services in Cambridgeshire, but as of next week, the service will be accessible to all people in Cambridge and Peterborough who are potentially having a mental health crisis, need support, advice, maybe signposting to other services, and that will be accessible to a number which will be released around this week, and for people to call 24/7 mental health professionals there at all times. There also will be a response to that service. Sure.
Can you hold the mic a bit closer?
Sorry.
While we've got a break line, sorry, I forgot to mention there's a gentleman at the back that's filming, so if there's any members of the public who are uncomfortable with being filmed, you can just let yourself know. The gentleman stood at the back in the white t-shirt.
Who is he, did you say, Chair?
I say he's a gentleman, I don't know beyond that.
Just who's the gentleman? No, he's filming. He's filming.
There's a member of the public behind you filming.
Right.
I think the main message that I wanted to get across today with the crisis service was that as of next week, people with mental health crisis will get support quickly. They don't have to be doing any other route referral. It'll be open access. So for calling in and getting immediate help, because one of the things that we heard from people whenever we were doing the engagement events is, if only I'd have known at the start where to get help and support from, where to go, what to do, then actually that would have helped me and my carer, all of those kind of questions. So actually what we're delivering is that we're going to be delivering that you can contact no matter what time of the night or day, and there will be a mental health service there to help you support in that crisis. If it's not a crisis, we can help support and advise on to other services, link you into things that's currently happening in the community with other services, and that's where we're coming on, because we're also partnered with Mind. So Mind are providing a sanctuary service. We've got currently one operational in Cambridge, and the second one will be going operational next week in Peterborough. And the service will be providing between 6 p.m. and 1 a.m. a physical place for people to go and actually talk to that crisis. So we'll have the ability to phone up, but actually if someone needs to go and work that through, they can go to the sanctuary, and where Mind staff will be able to actually support people through that. We also have got a patient story actually of some of that's been happening in Cambridge already. I'm aware that actually I could talk for a long time on first response, because I've been doing it for a long time and I'm very passionate about it. So I'm going to hand over to the patient story now about what's been happening so far.
Okay.
My name is Jane, and I have visited the sanctuary in Cambridgeshire 6 times. The first time I visited, I didn't know what to expect or what was expected of me. It was such a relief to find out that nothing was expected of me. I could talk honestly about how I was feeling without being judged. The staff, especially Danny and Tracy, have always made me feel so welcome. I don't feel like I'm being a nuisance, and I feel like the staff understand that I don't want to feel this way, but sometimes everything seems so hopeless. I am allowed to sit in silence if I don't want to talk. I'm not hassled about what I should be doing or how I should be feeling. Other times I want to talk. I have so much going on in my head, and in the past, the only way out of feeling like this has been to cut myself. Often, I would cut myself just so that I could go to hospital. It can be little things that push me over the edge. My support worker not turning up, or my hospital appointment being cancelled. When I get anxious, it is hard to resist the impulses to self-harm. The stronger the impulses are, the more trouble I have going to sleep. And as soon as I don't sleep, I get more and more anxious. I get so lonely at night, and that is when I self-harm, and it helps me deal with feeling anxious. Now I can go into the sanctuary. I know that I have somewhere safe to go. Staff never seem to get fed up or annoyed with seeing me. They even make me tea and toast. I have felt so isolated, and now I can come here and bring my mum if I want to. I like that I see other people who are struggling too. I feel less lonely. The sanctuary is the first place I have been to, but doesn't judge me if I get angry. They are okay with me. I can't tell you how nice it is to know that I can keep coming back if I need to. There is going to be a time when someone says, "You've been here 10 times now." Thank you. Thank you for making Sanctuary so nice. It hasn't been put together with some second-hand furniture. When I come in, I feel like you really care with me. Thank you for keeping me safe.
Okay, that's great. Thank you so much.
So I'm just going to sum up by saying that the funding that's come through for the Vanguard is kind of, we're there for us to test this model out, and actually we want to make sure it works as much as possible, because people have said they need it. And I guess that we want to be a more appropriate place for people to go looking for an A&E, because that's mental health, and they have to go and get support there and then and actually be able to do that. So I think the message is getting across that actually if you're there, it's kind of mental health A&E.
Okay, thank you very much. So the paper that Elaine was talking to has come from information that outlines the exciting development of mental health services that are coming online very shortly. And again, another powerful story from one of our patients that reminds us just why what we're doing as a commissioning organisation is so important to the patients in Cambridgeshire.
Firstly, thank you very much, Elaine and Jane, for that. And Jane, particularly for you for coming to talk about your experiences.
I'm just reading it on behalf.
Oh, sorry.
Sorry.
Thank you as well. Thanks to them then. Sorry. And I think it's good to hear people who are quite happy with something that's being provided. There was certainly a desperate need for this, and it was heavily missing before. Two questions. One is, how will we be able to be sure that there's enough capacity when it goes live to everybody? Because the idea that people can just show up any time and as many times as necessary is great, but we need to make sure that there will be the capacity and the availability to deliver on the 1 hour promise and things like that. So I'd be interested to know about that. The other thing is how to make sure that the people who need to access the service know that it exists. I hope there's a communications plan there, but some of the people who need to get to this are slightly hard to reach individuals. So I'd like to know how you will make sure that people aren't not aware of this.
There is a communications plan. I guess some of it's tied in with the regarding the number. But we have got it to go out on buses, on the radio. Every single service user of CPFT will have that letter. The care plan templates we're changing to have in emergency contact first response. We have been going out doing some engagement work, and we're planning that continued to do that over the next week. We've been having a Sun network and service users and carers on the delivery road right from the start. The message has been going out. The first question was capacity was main. So I guess I went and looked at other areas. The main one was actually in Bradford, and also looked at central North West London, and one's similar population size. They've got a model that's been up and running for 12 months. So we were able to get a lot of information from them, what they started, the staffing model that they had, what kind of calls were coming in. So we've estimated what the calls might be in the first 3 months based on 3 number sites. And the staffing model that I've done against that is looking about how many calls we manage per hour and how many we need on at one time. I'm sure there will be problems, and I'm sure that we might not get it right, and it might need adjusting because we don't know exactly what's going to happen within that, but I've done it as tightly as much as possible based on other areas as much as possible. We've got good pathways aligned next to us. For example, the teams have worked alongside first response. So making sure that the children's pathway, making sure that the other adult crisis pathways are in there, and the home treatment team, and the AMP service, and the EDT service. So we've had those on board so that as soon as people come in, we can try and get into the most appropriate services as much as possible as well. Doing that.
Okay, thank you. So we've got Kathy and then Jess, please.
Thank you. All sounds great. When does MyGov go live for GPs?
I think that question, I prefer that's for potentially someone from the one stream, because I'm not sure of the answer. I think we're part of the MIDOS, as in we're actually going to be in it, and the fact that mental health, and I know that they're looking at expanding, having the Cambridgeshire network and the Peterborough network and the local authorities on that. I'm not too sure of their timeline, Dr. Brennan, to give you that example, but I can come back to you on that.
Is that working? Oh, good. Thanks very much for the presentation. Just to say that last week I was at a similar presentation to the Cambridgeshire Scrutiny Committee of the councillors, and they were really impressed with the project. They were very supportive of the way it would be evaluated, and that was really important around accident and emergency, but also wider community evaluation around the referrals to the police, but also evaluating that impact for families, members as well. So just wanted to say it went down really well, and I think we really support it. And to thank Jane, although I know she's not here, for sharing her experience, because I think that's important.
Thank you.
Okay, then to Kate, please.
Thanks for the presentation.
Can you use the microphone, please? It can't be. No, use the microphone, please.
Can you hear me now? Thanks for the presentation. My concern is, you mentioned something about the children, links with the children's services, but my main concern is the 16 to 18-year-old group, and them presenting and them getting access to the service. And as a GP, working both in the out hours and in hours, when I've always tried to refer this age group, I've always found it difficult to get them in the right sector. How do you propose to make sure that they are catered for?
Transitions, that age group has been difficult nationally. I think that the one way we're trying to capture it is that the sanctuaries actually are from 16 and up. So actually there will be a physical place now for between 16 and 18 to go if need be. But also adolescents, young people can access the teletriage system, so people can call up at home, wherever they are actually within Cambridge and Peterborough, if they're registered within Cambridge and Peterborough, and contact and speak to mental health advisors there and then. And an assessment will actually take place there. And it might be that actually they can get the advice, the support they need at that time, there's nothing else required, or they need to be actually referred into another service. And that's where we've got in the MIDOS and trying to have most of our mental health services in there as well. The sanctuary is then equally there for people for 16, 18, and we've got one in Cambridge and the other one's opening next week. And we're also trying to get some outreach into Huntington, mainly because the numbers haven't been as high within Huntington, but we have got on 2 nights at least some crises going in to help people in Huntington area and work through that crisis, and that's kind of going to be remotely as well. We've also looked at, because there was some additional for children and young people, so we're looking at speaking to a company called CUF.com. CUF.com deliver online counselling and support for people from 11 up to 25 actually, and what they will be there is that we can actually use them as for young people so that they're contacting if they're feeling depressed or suicidal or really, really struggling. Actually, we can then say that you can actually access this and get straight on, and then counsellors will be online. So, and what we find from other areas is that actually lots of young people, they just need to be able to tap in on occasionally. So if it's 3 times a week or 4 times a week, just to get over that crisis point and work it through. And if they need more ongoing counselling, up to 12 sessions, for example, there are accredited counsellors within that. This is a company that's been going for 10 years. It's commissioned by 30 other either CCG and local authorities. It's got a good reporting record, and actually take up recently within Hertfordshire, for example, has been extraordinary regarding that, and because people are able to use it and they are able to take quite a high risk profile.
How do you spell that? Big Hertfordshire, it sounds very important. How do you spell that?
COOTH, KOOTH.com.
Cruise.
.com.
As like
Yeah.
Double O T H.
Yeah.
Okay, thank you.
Okay, that's lovely. Thank you ever so much. So that was the mental health Vanguard update paper. We turn to recommendation on page 3. Governing body is asked to note this update and next steps in developing the mental health crisis response service (CCGY) from the 19th of September 2016. Governing body happens to know that. Lovely.
Thank you. Can I just say thank you to Elaine and also Caroline Miser-Stedman, who's the consultant who's worked with Elaine on this and the whole team. I think they've done a tremendous job of getting this off the ground from nothing, using the Vanguard monies. I think I do have to point out the risk, though, that this does need to demonstrate that it financially kind of covers itself in terms of the reduced costs of admissions to hospital before as a CCG look at substantively. So thank you for your tremendous and really hard work that you put into that. It has been an example, I think, for everybody about how to set up something new. It does need to be fully evaluated, and then once that's been done, then we'll look at whether it can be substantively funded. It would be great if it can be. It's a good service.
Okay, lovely. So if we can move on to agenda item 1.2b.